Hello everyone, I am Sanjana, Onco nutritionist from ZenOnco.io. Today we shall be speaking about the healthy swaps in traditional Indian recipes for the cancer patients. Adjusting the traditional Indian recipes to better meet the nutritional needs of the cancer patients can not only be rewarding but it can be a healthful endeavor as well. Indian cuisine is celebrated for its diverse spices and also for the vibrant flavors also, and it uses a myriad of vegetables and grains as well. However, certain traditional cooking methods and ingredients might need to be swapped for the patients who are undergoing cancer related treatments as well, so that this will ensure that the meals are nutritious, they are easily digestible, and they are also going to be supporting the overall well-being as well. Now let us go and see what are the healthy swaps which are going to be important and they can be also taken care of for a patient who is undergoing a cancer related treatment as well. First is whole grains. So always choose whole grains over refined grains. Now whole grains, for example millets, they are a good source of protein, fiber, and they are easily digestible as well. The common millets which we have in India are ragi, jowar, bajra, and also foxtail millets, to name a few. So all of these are easily available in the market. They are known to be not only good in fiber, but they are easily digestible, and they also help in maintaining the sugar levels as well. Now also fiber, as we know, is important for the gut health because it also helps in preventing constipation also. When you take refined grains, mostly maida, so what happens is this is a processed form of wheat, and again it is not considered to be a good for health. When you consume rice, so as we know in India, rice is the staple food in most of the regions of India. Rather than consuming white rice as an alternative, you can surely consume millet rice, or you can consume brown rice or red rice as well. White rice has more of starch, which is ultimately converted to fat in the body. Next is you need to increase the usage of plant-based ingredients as well. So it is good to incorporate in our diet a great variety of vegetables and legumes in our dishes. Now in India, most of us have dal as a staple food along with rice in our meals. You can add a dal or beans and a colorful array of vegetables as well, and this can enhance the nutrient content of a meal. Mainly we see that for cancer patients, a rainbow plate is a concept which is used. When your plate is colorful, that is when the food is also, it looks appealing, and we also feel to enjoy the food and eat it as well. Next is reducing the salt and using of herbs. Most importantly, especially for patients who are undergoing cancer related treatments, you need to limit the use of salt in your diet, and you need to also rely on a rich palette of Indian spices and herbs, because this is going to be flavoring your dishes, and it also helps in offering anti-inflammatory properties. In the Indian cuisine, the most common spices used are your turmeric, cinnamon is there, you have your cloves, and your cardamom also. All of these are going to be enhancing the flavor of a food. Now already, as we have seen, for the cancer patients who are undergoing various cancer related treatments, or they might be on medications as well, they also experience a loss of taste or taste alterations. This is the time wherein we need to incorporate alternative options like herbs or Indian spices, which will help in enhancing the flavor of the food, and it makes it palatable for the cancer patients as well. Next is healthy fats. Healthy fats are also important because it is also having a cardioprotective role as well. So what you can do is You can swap out the ghee or high fat dairy products for healthier fats like olive oil or even rice bran oil as well. Ghee can be used in moderation or in a small quantity because it is also good for the gut health also. But if you ask for daily cooking, then yes, you need to look out for options like olive oil, rice bran oil, or extra virgin cold pressed coconut oil as well. Now these oils, they can be used in moderation to prepare the dishes which you would like to have. When I speak about dairy products, again for the cancer patients, we encourage to take A2 milk and milk products. Specifically, the reason being that A2 milk and milk products contain a different kind of a protein called beta casein. This has a good protein content, less of fat, and it is also easily digestible as well. Next is sugar alternatives. For the cancer patients, we always ask them and always encourage them not to have much of sugar intake in their diet. So now, what are the alternatives which you can include? As we know that refined sugar is nothing but the white sugar, and it's mostly visible, and mostly it is present in the sweets and the desserts as well. India is a diverse country wherein most of us relish on the sweets, and they are also high in sugar content as well. But for the cancer patients, we need a healthy swap. So you can consider the using of natural sweeteners like dates, figs as well. Now, for example, if a patient would like to eat anything sweet, you can give them a dates jaggery laddu or oats dates laddu, for example. So these are natural sweeteners which can be surely incorporated into the diet of the cancer patients. So to conclude, healthy swaps through the Indian traditional recipes is extremely beneficial because it is going to help in improving the nutritional intake of the patient as well, and it can have an overall positive impact on their health also. Thank you so much for watching my video today. We at ZenOnco.io are here to navigate you through your cancer care journey. In case of assistance, you can surely reach out to our cancer coaches on the below mentioned contact number. Thank you.